The next couple questions I have here are actually from parents of a child with CF. First one is, our middle child has CF, and as parents we are struggling with depression. How do we prepare for the impact of CF on all our children's mental health?
Well, I think the most important thing that parents and other caregivers can do if they're struggling with depression or anxiety is to address that in themselves. Again, in that plenary we saw such a nice role model for how Andy was teaching his kids how to take care of themselves physically and how to take care of themselves mentally by modeling exercise, by modeling, hey, I go to therapy and I talk about when I'm not feeling so good. We know that it can be harder for depression to improve in kids if parents don't take care of their own depression. So you think of it kind of like when you're on the plane and they say, you know, put your oxygen mask on first and then put that mask on to your kids, right, or people who can't help themselves as well. So first of all, parents, take the time to take care of yourselves. It can be really hard to kind of stop that train of thinking I always have to take my kids' needs first. Take care of yourself. And also, it is important to think about the siblings, although siblings of kids with CF can be very resilient and very compassionate and empathetic as a result of growing up in a household where a brother or sister has CF. Sometimes they can also feel a little lost in the shuffle. So it's always okay to ask your care team, can I have another copy of that screen to screen his brother or sister, or can I talk to the pediatrician about how he's doing? Make sure that everyone has a chance to talk about how living with CF impacts the whole family.